Back with you now here on the Newsfeed Late Night. The 2020-2021 Amnesty International Report has found that the COVID-19 pandemic has exposed the terrible legacy of deliberately decisive and destructive policies that have perpetuated inequality, discrimination and oppression across Sub-Saharan Africa. The Executive Director of Amnesty International South Africa, Shenilla Mohamed, joins me now to talk about this. Shenilla, good evening, and thank you very much for your time tonight here on the Newsfeed Late Night. The pandemic hits as already much of Sub-Saharan Africa is shackled by oppression. Its hardest hit by decades of inequality. Talk to me about how this report has exposed how countries in the Sub-Saharan region during this time of the pandemic have weaponized the COVID-19 pandemic to ramp up their assault on human rights.
Good evening, and good evening to your viewers. Well, Amnesty, each year we produce what we call the State of the World's Human Rights Report. And this year, our 2020 report covers 149 countries, including 35 in Sub-Saharan Africa. Now, what we're seeing, in our analysis over 2020 is that it's not just in Sub-Saharan Africa, although, we are seeing high levels of weaponization and human rights violations, but it seems to be the trend across the world. That COVID-19 really sort of brought amplified inequality, justice and discrimination. And so we had communities that were already reeling from inequality, poverty, previously disadvantaged communities, and COVID-19 came along and their situations got worse and worse. And in Sub-Saharan Africa in particular, the countries where there are, where there's been conflict, we've seen that the situation has been even worse, to the point where we've had countries like Uganda turn away desperate asylum seekers who are coming there trying to escape from conflict. So, our analysis shows that for the majority of people, COVID-19 just made their lives just horrendous. Yeah. And again, it's all about poor leadership. We did not have globally, not just in Africa, the type of leadership that could lead us out of a pandemic in a way that would not result in the devastation that we're seeing in many people's lives today.
Is it coincidence that we are, during this time of a pandemic, also seeing a rise in conflicts between states and armed groups, insurgency that is rising around Sub-Saharan Africa? I mean, we were talking Mozambique moments ago, but also Nigeria has been seeing a lot of that.
Conflicts in both Mozambique, Nigeria, Ethiopia. I mean, yes, we've seen them come to the fore, but they're not new. I mean, those are conflict-prone countries anyway. The issue that's really being exacerbated in Mozambique at the moment has been going on for the past couple of years now, and it's just reached a point now where things have really gotten out of control. But what we basically are seeing is that these were countries that were already conflict prone. But then, with COVID coming along, governments then dropped the ball a bit, so everything became about, dealing with COVID, or in some cases like Tanzania, not dealing with COVID, denying its very existence. And COVID then really became an excuse to drop the ball in countries where leadership was already problematic. And I think, what our report is showing, that not just in Africa, by the way, this is not just an African issue, that, throughout 2020, leadership was not shown by the leaders of countries, but by the ordinary people, the health workers, people who were at the forefront of it. So, the conflict zones, yes, we're seeing problems arise where refugees and asylum seekers are not being allowed entry in the name of COVID. But these are areas that, have been involved in conflict for some time now.
Talk to me then about the security forces themselves. I mean, we've had a conversation earlier on how the security forces would have allegedly taken a life here in South Africa, for example. They have also come up in this time of the pandemic to have committed grave human rights violations against civilians.
Well, this is what we mean when we talk about weaponization. So, in South Africa, we saw ourselves that, the army was deployed. The army is not trained in public order management. They do not have the skills. And we saw that unfold in the death of Collins Khosa. And then, again, remember that this is a country in South Africa where we've seen deaths in the, overuse or excessive use of force at the hands of the police anyway. It's not new. We've seen it happening. We saw it happening a few weeks ago, with the Wits riots, protest action. Today and yesterday, we've seen some more protest action where, the police are out there using rubber bullets again. So again, what we're seeing, what we saw during 2020 was really a situation where human rights became even more compromised. And, the deployment of the security forces was in itself a violation of rights because, unless you train them in public order management, they don't know what they're doing. And then, things just start falling apart, excessive use of force. They're trained to kill. They're not trained to contain. And that's really what the problem was. But we also saw, as we know in South Africa, but this was not just in South Africa, this was across the board throughout the world, which is the most frightening thing about this, an increase in violence against women. So again, it wasn't just rights being violated outside of the home, it was rights being violated within the home. And we saw in South Africa that the increase in the number of cases of domestic violence and intimate partner violence during COVID. And South Africa already has, 5 times the global average of murders, of women being murdered in this country. So again, human rights violations took place both externally and internally. And, COVID just made the whole situation worse. So, in a nutshell, 2020 was a terrible year for humankind. We did not fare well. We did not do well. And, we really do need to rebuild, not only to make sure that the world is safe from COVID, but to rebuild and make sure that, those policies, those destructive things that were not dealt with in the past, the inequalities, the lack of facilities and water. I mean, water was another one in South Africa where people just did not have access to water. So, delivery of basic services needs to be dealt with. COVID came along and it showed us why it's so important that everyone has running water, why it's so important that people have the facilities they need. And so many households were without water in South Africa during 2020.
Yeah. And I suppose that's what you're talking about when you're saying the country's governments should urgently reinvest in the broken or in the repairing of the broken social systems, but also the broken economic systems. How quickly are countries in Sub-Saharan Africa dealing with that?
Well, I think, I think at the moment, countries in Sub-Saharan Africa and globally are focused on the accessing of vaccines. I don't think that a lot of attention is being paid to, broken systems at the moment. And I think that is what the problem is, that even after COVID, those systems will be not only broken, but will be even more broken and unusable. And so, in answer to your question, no, countries are not paying the attention they should. At the moment, it's all about vaccines. And of course, we've seen this trend come out globally, which is, really worrying, which is a trend of, selfish national interests, even when it comes to the vaccines. It's about, let's get everything for ourselves, let's hoard, let's not give to the countries that need them. So you can see that, the countries, poorer countries, and countries in Sub-Saharan Africa are so busy trying to get hold of these vaccines in order to vaccinate their people that seems to be their main focus. So as a result, many of the broken systems, which were broken even before COVID, are not being paid attention to. So we're going to emerge from COVID with systems that were dysfunctional before, but will be even more dysfunctional. And of course, let's not forget the whole issue of corruption. We've seen it in South Africa. We're seeing it across the board, not just in Sub-Saharan Africa, where, even with COVID, we are seeing corruption. We saw it with the PPE scandal here. It's just, so again, I just want to reiterate that leadership has failed dismally across the world, Sub-Saharan Africa and in South Africa, because, we're still in our rollout, we're very slow. We're not dealing with issues that need to be dealt with. Schools are not functioning in the way that they should. Houses still don't have the water. We keep on getting reports of water shortages. So, at the end of the day, if the state does not put into place a plan that is about rebuilding, but rebuilding better, then, we're going to stay in this chaotic state for the next couple of years.
Talk to me about the refugee situation and how the country's doing. We were talking, I think, earlier on this week, for example, of Kenya giving the UN refugee centers there to close down. I think they gave them 30 days, actually, 2 of those camps.
And this is what, we talk about when we say the weaponization of COVID. I mean, under the guise of COVID, human rights violations are taking place. So, yes, we've got the situation in COVID. In South Africa, when the health minister first talked about the rollout plan for vaccines, it was said that the only people who would get vaccines are people who have, a permanent residence or a South African ID document. Now, Amnesty South Africa, in 2018, we released a report that was called Living in Limbo, which really looked at the state of the system, the refugee and asylum system in South Africa. And what we found was that it was a broken system, which meant that people were living in limbo. So you have a lot of people in this country who don't have those papers, who don't have those documentation that will allow them to even get the vaccine. Fortunately, with the pressure of civil society and organizations like COMSA and Amnesty, the president came out and clarified that. But, we're seeing this across the board. We're seeing it, in Western countries where refugees and asylum seekers are not being prioritized. And then, of course, let's not forget Uganda, that was refusing to allow asylum seekers, even into the country. So if you're going to close down camps, if you're not going to allow them in, these are people who are running away from genuine conflict situations. Where are they going to go? What is going to happen to them? And there doesn't seem to be a care in the world. And that's what I was saying, we've developed this me, myself, and I selfish attitude to the world, where let me just close my borders, protect me and my people, and forget about the rest of the world. But, you can't do that. And it's going to show it's going to come at a cost. And we're going to lose a lot of African lives because our African leaders are not valuing African life in the way that they should.
Now, we've seen a number of protest movements during this time, the world over. I'm not just talking here in Sub-Saharan Africa, but throughout the world, really, who have risen up during this time and stood up against the regressive policies that are in existence. I mean, just talk to me about some of the wins of 2020.
Well, if we were to say who were the heroes of 2020, it was those very people that you're talking about. It was the average citizen, the average African citizen, the average global citizen that said, you know what, we're not going to put up with this, and went out and tried to fight for some rights. And, we saw that, across the board. We saw that happening in Hong Kong. We saw that happening in China. We saw that happening, in many parts of the world. And that for us was the one shining light, in this whole COVID darkness, was that, if there were any heroes of the day, it was the average person who really was not going to be, oppressed, and that fight for human rights was still there, and the realization that rights were being violated was still there. So we didn't have a cowering population that was, terrified into submission. We had people who were still willing to get up and fight for their rights. And I think, those are the heroes of 2020, the ones who stood up to fight for the rights of health workers, to fight for PPEs, to fight to make sure that, that we have an equal approach to dealing with COVID and not treating some people more equally than others. And I think, that fight continues. I mean, we're still, as Amnesty, fighting for the fact that, everyone needs to be getting vaccines free of charge. Everyone should be getting quality vaccines, and there should be no trials happening and experiments happening on African people. We should make sure that any vaccine that comes to Africa is a vaccine that has been properly tested and a vaccine that is going to, yield the results that it's intended to. So, I mean, the battle continues. We have not we can't stop. We have to keep fighting to make sure that human rights are upheld throughout Sub-Saharan Africa and globally.
Director of Amnesty International South Africa, Shenilla Mohamed, appreciate your time. Thank you very much for joining us tonight.
Thank you.